Everyone, my name is Latal, and I am your dietitian and certified diabetes educator and specialist. I wanted to invite you to listen to a few of these videos on the topic of diabetes and being newly diagnosed. And the reason why I'm passionate about this is because I have so many clients coming in overwhelmed, newly diagnosed, and they feel lost because all they got was, you have diabetes. Imagine just walking into a cold office with your doctor just giving you those news and little to no more elaboration on your diagnosis and how that would feel. So it just pains me to hear that these clients are not really getting the information that they deserve to know about their new diagnosis. And so I wanted to create an offering that talked about this and empowered more people to take control of their health before even having to seek out more help from either dietitians such as myself or going back to their doctor and still feeling like they have a laundry list of questions about their diagnosis. So how it will work is I will offer a few of these videos on various topics. And the first that I wanted to discuss is this topic of what is diabetes and what is the difference between type 1 diabetes. In the past, we heard maybe the term adult onset, and now we're starting to find that type 2 diabetes is often found in not just our adults, but also we're starting to diagnose more and more adolescents and kids with type 2 diabetes. And so what is the difference between type 2 diabetes and type 1 diabetes, which also used to be known as juvenile diabetes? While it's true that a lot of kids are being diagnosed with type 1 diabetes at an early age, it's not a complete anomaly or uncommon to see someone in their early teens or later. Even I've had an adult 30-something-year-old being newly diagnosed with type 1 diabetes. So I just wanted to spend some time, a minute or so, to discuss the differences between these two types of diabetes. Now, there are a lot of other types of diabetes out there. MODY, which is mature onset diabetes, something I forgot the last letter, I'm sorry. So that's a little bit different. And then, of course, there's diabetes secondary to certain conditions with pancreatitis, steroid use, cancer, along with, the really intensive chemo that cancer patients have. There's secondary diabetes. So that's really not what I'm talking about here. I'm just talking about, in general, difference between type 1 and type 2 diabetes. So I'll actually start with type 2 because that's a little bit more common, and then we'll talk about type 1. So type 2 diabetes, there is, in every kind of chronic condition, there's what's called the etiology, which is where it comes from. Why is it here? There is a genetic predisposition. So you might kind of take it back a few generations and find out that your mom had diabetes or your dad had diabetes or both of your parents had diabetes and you had it and your grandma had diabetes. So there is a familial or genetic predisposition to type 2 diabetes. It is often seen in, and this isn't always the case, but in people that have excess weight on their body, so they have fat on their body. And a majority of that comes from central adiposity, which is fat centered in the center region of the body, so around the central organs like the heart and the liver and the kidneys and the pancreas, which is responsible for making insulin, which is in another video. But that is the difference. Is, you know, we often see maybe people that carry excess weight with diagnosed with type 2 diabetes. So that's a risk factor. And that may be due to, again, you know, the way that the body composition is. It could also be due to things like lack of physical activity or like sedentary jobs. Food choices can definitely impact the weight, which then can impact the diabetes diagnosis. Environmental factors. So, you know, if you're in an area with a lot of pollution, in an area that's hard to get around, you might be driving more often. Maybe you're in a food desert and you don't have access to fresh produce. So it gets a little bit more granular there. Stress can definitely impact the diabetes. But that's mostly what you see with type 2 diabetes. So it's a mixture of lifestyle, so smoking, also smoking and alcohol in excess can increase the risk, but it's a mixture of lifestyle and genetic predisposition. With type 1 diabetes, it's more of an autoimmune type of chronic condition. So the etiology is kind of unknown, but just as a quick way to explain it, the body starts to attack the pancreas, and the beta cells are the cells that are responsible for creating insulin, and they are destroyed. So that's where we hear the difference between insulin deficiency and insulin resistance. Type 1 is insulin deficiency. There's no insulin that's being produced, which makes that patient insulin dependent. They need insulin in order to survive. And then insulin resistance is in type 2 diabetes, where the pancreas may still be making insulin, but it's not being properly used. There's too much sugar that's in the blood. It's almost like a supply and demand situation. And that's why that's the main difference between type 1 and type 2 diabetes. Type 2 diabetes can be managed, can be very well managed, where it almost seems like it's reversed. But I'm here to say that if you've heard a news article or, you know, a magazine cover or a friend say you can reverse diabetes, you can get rid of it, don't be alarmed when you find out that that's not the case. I'm not trying to scare anyone, but I'm trying to be realistic. You can't get rid of it 100%, because guess what? If there's a stressor, you know, are put on a certain medication like a steroid, or you know, something happens to maybe get you from managed to unmanaged, the diabetes didn't come back. It was always there. It's just no longer managed. So with that being said, type 2 diabetes, you can manage it for the rest of your life and not experience any chronic complications. And if you start off with a lot of medications, you can slowly get yourself off of it with lifestyle changes. So there's a silver lining. With type 1 diabetes, there's a lot of athletes. I love, one of my favorites is Robin Arzon. She's an instructor in at Peloton, and she's really badass. And she has type 1 diabetes. Nick Jonas has type 1 diabetes. There's multiple celebrities that have type 1 diabetes, but everyday people that live very healthy lives, but they are insulin dependent for the rest of their lives. So hopefully that clears this big question mark up of what is the difference of these two main types of diabetes, which one do I have? Because that's not always expressed at that doctor's visit. And that's important for you to know, not to label yourself, because you are not your diabetes. You are a person with diabetes, but just to kind of understand, why are you taking an oral medication and not insulin? Or if you have type 1 diabetes, why do you have to take insulin for the rest of your life? I hope this is helpful, and I will continue to put out more content. Please send me a message if there's anything that was unclear or you want sorted out for you. Thank you for watching. Bye.